I hope you're doing well. Today we will see what are the essential facts to know about sciatica. This video is brought to you by Question Response. Today the answers will be presented by Myra Rowan, Nadia Javicki, Kayla Lukes and Anthony Davenport. We will start with the first answer of Myra Rowan.
Sciatica is also known as lower back pain. Sciatica pain can start in the lower back and travel through various parts of the body, including the buttocks, thighs, legs, and even toes. Pain in the legs and feet manifests itself depending on the extent of the disease. Other symptoms include weakness in the muscles of the arms and legs. The sciatic nerves are the largest of their kind in the body, about the size of a human little finger. They are located close to the spine and then spread to the hips, buttocks, legs and feet. It differs from other low back pains because it spreads to other parts. It is important that people know more about sciatica in order to understand its consequences and possible treatments. Causes. In addition to a pinched nerve, irritation and compression of the sciatic nerves can also be caused by other disorders or medical conditions. For example, one of the most common causes of sciatica is a herniated disc. When the disc slips, it directly hits the sciatic nerve over it, pressing on the nerve until it is compressed. This is followed by swelling, which causes a painful sensation. Another cause is spinal stenosis. This type of condition refers to the way the spinal canal narrows, compressing the nerves. This condition can occur late in a person's life because old age usually causes bone weakness and narrowing of such pathways. Other conditions that can lead to sciatica include Spondylolisthesis and Piriformis syndrome. Spondylolisthesis refers to a condition similar to a herniated disc, but this time it is the spine that has slipped and caused pressure on the nerve. Piriformis syndrome, on the other hand, traps the sciatic nerve in the buttock area, putting stress on the nerve and causing it to swell. There are other causes of sciatica, but the main idea is that any force or event that stresses the nerves can eventually cause sciatica or lower back pain. Therapy. It is possible that sciatica can be treated by staying as restful as possible. A few days of rest and less physical activity should help release the nervous tension that leads to the subsidence of the inflammation. Cold packs also help relieve pain and reduce swelling. However, if this does not work, medication can be given. Some conditions of sciatica can be treated with over-the-counter pain relievers. In some cases, affected individuals may need to consult a doctor for more effective and stronger pain relievers. Depending on the extent of the disease, drugs may be administered by injection. In worst-case and specified scenarios, treatment may also include surgery. Also, massage helps relieve sciatica pain. It also helps in prevention. Massaging the painful area and then applying ice can provide good results, as can reflexology. Working on reflex points located around the sciatic nerve can relieve sciatic nerve pain. Regular yoga practice is also used to promote the healing of sciatica. Stretching the muscles can help relieve pressure on the sciatic nerve. Acu-hump Sciatica Stretcher is a scientifically tested massage tool that provides relief from sciatica pain in the hip and buttocks. Acu-hump can be used on the lower back up to the hip to provide relief from muscle tension and nerve pain. For more information, please visit here. Sciatica massager.
We continue with Nadia Javicki's answer.
Sciatica refers to pain that travels along the path of the sciatic nerve. The sciatic nerve travels from the lower back through the hips and buttocks and down each leg. Sciatica most often occurs when a herniated disc or an overgrowth of bone puts pressure on part of the nerve. This causes inflammation, pain and often some numbness in the affected leg. Although the pain associated with sciatica can be severe, most cases clear up with treatment in a few weeks. People who have severe sciatica and serious leg weakness or bowel or bladder changes might need surgery. Symptoms. Sciatica pain can be almost anywhere along the nerve pathway. It's especially likely to follow a path from the low back to the buttock and the back of a thigh and calf. The pain can vary from a mild ache to a sharp burning pain. Sometimes it can feel like a jolt or electric shock. It can be worse when coughing or sneezing or sitting a long time. Usually, sciatica affects only one side of the body. Some people also have numbness, tingling or muscle weakness in the leg or foot. One part of the leg can be in pain, while another part can feel numb. Mild sciatica usually goes away over time. Call your primary care provider if self-care measures don't ease symptoms. Also call if pain lasts longer than a week, is severe or gets worse. Get immediate medical care for sudden, severe pain in the low back or a leg and numbness or muscle weakness in a leg. Pain after a violent injury, such as a traffic accident. Trouble controlling bowels or bladder. Causes. Herniated disc. Bone spurs on spine. Sciatica occurs when the sciatic nerve becomes pinched. The cause is usually a herniated disc in the spine or an overgrowth of bone, sometimes called bone spurs, form on the spinal bones. More rarely, a tumor can put pressure on the nerve. Or a disease such as diabetes can damage the nerve. Risk factors. Risk factors for sciatica include age. Age-related changes in the spine, such as herniated discs and bone spurs, are the most common causes of sciatica. Obesity. Being overweight increases stress on the spine. Occupation. A job that requires twisting the back, carrying heavy loads or driving a motor vehicle for long periods might play a role in sciatica. Prolonged sitting. People who sit a lot or don't move much are more likely to develop sciatica than active people are. Diabetes. This condition, which affects the way the body uses blood sugar, increases the risk of nerve damage. Complications. Most people recover fully from sciatica, often without treatment. But sciatica can damage nerves. Seek immediate medical attention for loss of feeling in the affected leg, weakness in the affected leg, loss of bowel or bladder control. Prevention. It's not always possible to prevent sciatica, and the condition can come back. To protect your back, exercise regularly. To keep the back strong, work the core muscles, the muscles in the abdomen and lower back needed for good posture and alignment. A healthcare provider can recommend activities. Keep good posture when sitting. Choose a seat with good lower back support, armrests and a swivel base. For better low back support, place a pillow or rolled towel in the small of the back to keep its normal curve. Keep knees and hips level. Use your body correctly. When standing for long periods, rest one foot on a stool or small box from time to time. When lifting something heavy, let your legs do the work. Hold the load close to your body. Don't lift and twist at the same time. Find someone to help lift heavy or awkward things.
We continue with Kayla Luke's answer.
Sciatica refers to pain, numbness, or tingling that begins in the lower back and continues down the sciatic nerve into the buttocks and legs. Sciatica is not a disorder in itself, but rather a symptom of some other underlying cause, usually a pinched nerve or a herniated disc in the lower back or lumbar disc, LDH. When a spinal disc herniates, the gel-like substance between the vertebrae can create pressure around the nerve, causing pain and dysfunction. When this happens in the lower back near the sciatic nerve, it can cause pain and dysfunction anywhere along the sciatic nerve, the longest nerve in the body. The most common symptoms of sciatica can include pain in the buttocks, pain in the back of the thighs and calf muscles, tingling or burning sensations down to the feet and toes, muscle weakness and numbness. You may or may not have associated back pain. Mild sciatica symptoms will often go away on their own, but don't ignore that there is a cause. Moderate to severe symptoms are likely to require professional attention. If your symptoms last longer than 1 week, you should consult a chiropractor. A chiropractor can assess the severity of your symptoms and find the cause of your dysfunction. If your sciatica is caused by a herniated disc, subluxated vertebrae, or pinched nerve, your chiropractor will recommend treatment including spinal manipulation, also called adjustments, rehabilitation therapies, and possibly disc decompression therapy to treat a herniated disc. Spinal manipulations are a conservative, non-surgical approach to treating sciatica caused by a herniated lumbar disc. In a recent study, Manipulation or Microdiscectomy for Sciatica, in the Journal of Manipulative and Physiological Therapeutics, researchers compared the effects of spinal manipulation with microdiscectomy, surgical treatment, in patients with sciatica caused by a herniated disc. The results showed that spinal manipulations were found to be as effective as surgery. All study participants suffered from chronic sciatica and did not experience relief from traditional medical treatment. 60% received relief from spinal manipulation to the same extent as if they had undergone surgery, warranting that patients with sciatica from LDH should consider spinal manipulation therapy first. 1. This study is good news for individuals suffering from sciatica from a herniated disc. Chiropractic is a natural, holistic practice and can help many patients avoid surgery. Surgery is expensive and involves risks associated with anesthesia, infection, and the development of scar tissue, which can lead to greater pain and dysfunction. Chiropractic is a safe and cost-effective alternative. Chiropractors are licensed doctors of chiropractic, DC, who are thoroughly trained in the biomechanics of the body and how to naturally correct them through manipulative therapies. Spinal manipulation should never be attempted by anyone other than a licensed doctor of chiropractic. A visit to a local chiropractor can help you safely and effectively manage your sciatica and treat the underlying cause of your pain. Apart from medical treatment, there is another effective method, and that is massage. You can easily get rid of this problem through massage. And a proper way to massage is to use a massager tool. The Acu-hump Sciatica Stretcher is a scientifically tested massage tool that provides relief from sciatica pain in the hip and buttocks. Acu-hump can be used on the lower back up to the hip to provide relief from muscle tension and nerve pain. For more information, please visit here. Sciatica massager.
What do you think? We will continue with Anthony Davenport's answer.
In 1997, 14-year-old Nathan Zoner presented his science fair project to his classmates, seeking to ban a highly dangerous chemical from its everyday use. The chemical in question? Dihydrogen monoxide. Throughout his presentation, Zoner provided his audience scientifically correct evidence as to why this chemical should be banned. He explained that dihydrogen monoxide can cause severe burns while it's in gas form, corrodes and rusts metal, kills countless people annually, is commonly found in tumors, acid rain, etc., causes excessive urination and bloating if consumed. Zoner also noted that the chemical is able to kill you if you depend on it and then experience an extended withdrawal. He then asked his classmates if they actually wanted to ban dihydrogen monoxide. And so 43 out of the 50 children present voted to ban this obviously unsafe chemical. However, this chemical isn't typically considered toxic at all. In fact, dihydrogen monoxide is simply an unconventional name for water. Nathan Zoner's experiment wasn't a legitimate attempt to ban water, but instead an experiment to get a representation of how gullible people can really be. Also, all of the points that Zoner used to convey his point were 100% factually correct. He just skewed all of the information in his favor by omitting certain facts. One journalist eventually dubbed this event as Zonerism, where true facts are used to mislead people towards false conclusions. And this occurs a lot more often than you think, especially when politicians, journalists, etc., use proven facts to persuade people into believing false claims. The fact that people can mislead, and be misled so easily, is highly unsettling.
This is the end of the video. Thank you for staying until the end. Remember to subscribe if you like the video. The likes also help a lot for referencing. You know what you have to do. We are coming to the end of this video. Share your views on this question in the comments. See you next time.